Welcome to another knee moment from Knee Fit in 5 and MSM Products. My name is Dr. Matt Lawless.
And I'm Scott Johnson, physical therapist.
The first letter today comes from Susan. She writes, I'm scheduled for a total knee replacement. I hear you guys talk so much about getting your motion back and how important that is. Isn't that going to aggravate my knee? Scott, what are your thoughts?
That's funny you asked me that, because this is probably one of the biggest reasons for my passion for physical therapy. It's a story that irritates me because it's about my dad. But my dad had a knee replacement about 20 years ago. At the time, he lived in another state. I didn't get a chance to see him immediately following the operation. But I gave him the same information that I give all my patients. I saw him about 3.5 months after his operation. I went to pick him up at our local airport, and he came around the corner with that infamous bent knee walk that you see a lot of people do that don't rehabilitate their knee. And I was just sick to my stomach about it, you know, and I said, Dad, you know, what's wrong? And he says, Scott, I can't get my knee straight. My hip hurts, my back hurts. I can't play golf. That's what he enjoys doing. And I said, well, Dad, come home with me. And it took me about half of a day through a conversation with him to find out that he was just flat out a bad patient. And so I sat down at the kitchen table with him and I said, Dad, you know, you can blame anybody you want for this, but the fact of the matter is you're a bad patient. You know, you didn't do the exercises that you were supposed to do. You didn't do them at the intensity that you should have done them. You've allowed the scar tissue to build up around your knee to the point that you can't get your knee straight. You potentially are going to limp for the rest of your life. He wasn't happy with me, you know, about that conversation, but it frustrated me so much and it saddened me so much to see, I believe, the quality of his life drop so much that it just really just put a fire underneath me. And if you want to know why I'm so passionate about rehab, you know, I've got a loved one that's going to limp for the rest of his life because he wasn't rehabbed properly. So to answer your question, Susan, getting that knee to fully straighten and getting that knee to fully bend, in my opinion, is the key to a successful knee replacement, and I can't emphasize that enough.
Interesting story, Scott. Sorry about your dad, but yes, I agree, Susan. The importance of getting your knee straightened and bent is very, very important. People do it easily. It takes a bit of effort, but you know, you will not aggravate your knee. You'll be able to do it quite easily. It will take a little bit of effort, but good luck with your total knee. See ya.
You know, the other thing that I thought about was, you know, that's why you and I got together to build the Knee Fit in 5 program, so that other people wouldn't go through the same things that my dad suffered with. You know, just the step-by-step daily exercise routine and the emphasis on what they should focus on so that they could have a higher quality of life.
Yes, the program we put together I am exceptionally proud of, because I do think it is exactly what everybody needs, and it standardizes care and makes it very easy to follow and get an exceptional outcome.